Hi, my name is Jacob O'Donnell, and this is my informative speech, and this is my audience. Alright, about a year ago from today, I was probably the happiest I ever was in my entire life. I invested money into a company, and through this company, I expected to become a multi-millionaire overnight. So what did I do? I got on a plane, went down to Orlando, Florida. I rented a car, a nice Ford Fiesta, had a nice steak dinner, enjoying hanging out with a bunch of people, feeling great. And this seemed completely normal to me at the time, but I realized it wasn't at all. What I was experiencing was a manic episode. My dad came down 3 days later, took me home, I was hospitalized, and diagnosed with bipolar disorder. What is bipolar disorder? It's basically a mental illness that is chronic, and it goes from extreme highs to extreme lows. And in today's speech, I'm going to be telling you guys about the symptoms, the treatments, and also what causes this disorder. Okay, so the first symptom I'm going to discuss is mania. Okay? Mania is a euphoric feeling. You feel basically like you're on top of the world. You're very inflated. You have a huge ego, like nothing can stop you. You're unstoppable. And another trait is rapid speech. So they're talking 1,000,000 miles an hour, faster than an auctioneer. It's ridiculous, okay? There's racing thoughts. Many ideas are popping through their heads. And with so many thoughts and going on, it's very hard to sleep. Lack of sleep, maybe 2 to 3 hours a night. And with such little sleep, there tends to be very terrible judgment. For example, spending a ton of money on a plane ticket down to Florida, renting a car, so on and so forth. Also, there can be careless drug abuse and alcohol abuse. And with this, you can be irritable and aggressive. And with all these highs, there tends to be a low point. And what that low point is symptom number 2, depression. In depression, according to NAMI, the National Alliance of Mental Illness, it defines depression as a medical illness where physical and emotional symptoms inhibit ability to function nearly every day for at least 2 weeks. And some of the symptoms of depression are hopelessness. You're feeling terrible, you don't want to do anything, you have no hope for life. There's a lack of energy, you basically just want to lay on the couch all day. There's anxiety maybe, even guilt. For example, you're feeling so guilty about something that happened in your past and you're just over-exaggerating, acting like it's a big deal. You have anxiety, you don't want to see your friends, you don't want to see your family, you basically just want to be left alone. And also there's a lack of interest in activities. For example, I'm in love with tennis, I love playing tennis, I can't live without it. And when I was depressed, I did not want to go anywhere near a tennis court. And also, unfortunately, there are suicidal thoughts or even actions. And according to the National Institution of Mental Health, bipolar results in a 9.2-year reduction in life expectancy, and 1 out of 5 patients do actually commit suicide. Okay, but luckily this does not have to happen if they follow their treatment. And most importantly is medicine. You must take your medication. If you do not take your medication, you're either going to go manic, way up there, or depression. And both are going to land you right back in the hospital. Okay? So no one has the same type of brain type, and we're all going to have different combination of meds. But here are a few types we have here. The first type is a mood stabilizer, and what that is basically its name. It keeps you from going too high or too low, keeps you right in the middle, and it's the main thing a bipolar person needs is a mood stabilizer. And right here I have lithium. And with these pills, they all do have side effects, and hopefully you do not get any of these side effects. But for example, a side effect that I have with lithium is I actually have acne for the first time, and I actually have dry mouth and have to drink a lot, but that's not terrible. Next is an antipsychotic. I don't have a pill here, but an antipsychotic is used whenever you're experiencing a manic episode. So say you're way up there, the doctor will give you a lower dosage to bring you back slowly, and then slowly increase the dosage, because they do not want you to fall into depression. Okay. Next is an antidepressant, and this is Wellbutrin. And Wellbutrin, what it does is basically helps you with depression, get you back feeling good, get you out of the dumps. But the thing is, the kicker, you don't want to take an antidepressant without being on a mood stabilizer. The reason for this is you can go manic by just taking the antidepressant because it will take you up too high. And then finally, we have a benzo drug, which is an anti-anxiety, and this is a Klonopin. And what does it? Gives you more confidence, makes you feel better and more comfortable. Basically, an anxiety pill. And a symptom that I have for that, a side effect I should say, is reduced muscle coordination. So not as good at shooting the threes for basketball, unfortunately, but it happens. Okay, so along with medication, you're going to have your therapy. And with therapy, basically you have your psychiatrist and your psychologist. And we'll start off with the psychiatrist. He's the one who prescribes you medicine. So you have to talk with him. You have to be very honest with him or her and let them know what if you're feeling good, can we reduce the medicine? Can we up the medicine if I'm feeling depressed? And so on and so forth. With your psychologist, that's the guy you just want to talk to. More of cognitive behavior type therapy. What you do is basically you're trying to work out the negatives and focus on the positives. And it's somebody you should feel safe with and express yourself. Finally, we have electroconvulsive therapy. And what this is, it's only for very severe cases where medication is not working. So they use electrical impulses and they go to the brain. Okay? And you might actually be wondering what causes this. And to be completely honest, it's actually unknown. But we do have some leads. For example, it could be genetic. If you have one parent that has bipolar disorder, there's a 15 to 25% chance that the child will actually be bipolar as well. There's also neurotransmitters which are in the brain, and that's basically an imbalance in your brain chemicals. And then finally, even the environment could play a toll in this. So if you had a traumatic experience as a child, you're abused, or have a high stress level, any of this could play a role, but it's not necessarily the key factor. This brings me to my conclusion. Bipolar actually affects 5.7 million American adults. That's about 2.8% of people. They all have symptoms of mania and depression. They've all had treatment, medicine and therapy, and they should follow it, but not all do. And the causes for everybody actually is unknown. The past year for me, as you can imagine, has been very up and down. I've been diagnosed. I was hospitalized 3 times, luckily at an amazing facility in Clarion. And I'm feeling great, feeling awesome, but most importantly, I just want to say there's no shame in having a mental illness at all. Thank you.